Florence Nightingale has well said that, so never lose an opportunity of urging a practical beginning, however small. For it is wonderful how often in such matters the mustard seed germinates and the roots itself. My name is Karuna Singh. Welcome to the channel Knowledge Star, Continuous Knowledge Excellence. People say nursing is the profession of females. But today, I welcome a very special guest who is professor in Community Health Nursing, Department of Nursing, Chitkara School of Health Sciences, Chitkara University, Punjab. Please welcome Dr. Gaurav Kohli. Welcome, sir.
Thank you for the warm welcome.
How are you?
I'm fine. I'm totally fine.
Okay, so I have used one phrase that is nursing is the profession of females. So, what do you want to say on that?
Yeah, I would say like it was a concept years earlier when I started, this profession. That time, people were thinking of like nursing is profession of girls only. So when we entered in and when we finished our first, I finished my diploma in 2005. So that time, that many opportunities were not available for male, nurses. So people were not readily recognizing them. But if we talk about today, like males are working in this profession very eminently. They have secured many positions, even administrative positions they have. So now there are wider opportunities for males because globally they have declared that males are quite competent and suitable for the administrative jobs in nursing. So that made a point here also. So India also started giving the opportunity to male nurses also.
Okay,
So
what?
in today's scenario, it's a bit critical. Yes.
Absolutely. Okay, if I talk about the career opportunities in nursing, so can you please elaborate on that?
If we talk about today's scenario, there are wider opportunities available for nurses. So we'll start from the basics, from the years like nurses are working in clinical areas, hospitals we used to say. So they're working as nursing officers. They can work in government, private, corporate hospitals. So nursing officer is again an opportunity. And if they go for further, like they want to be an academician, they can go further in study. They can be academician like me. So that is also opportunity for nurses in India. And they have opportunity to be community health officer, which is a cadre created by government under the NRHM, that is National Rural Health Mission. So they are, working independently, as we know that we are living in developing country and the proportion of healthcare personnel and patient is not still matched, and nurses contribute a lot in this proportion. So in that case they have started this practice, like nurses are working independently, they are running a clinic as community health officer. That is also an option. Again, it's a government job. So next is like if we talk about military nursing, that is also an option for all the nurses. They can work in defense medical services. Like it has like three wings in armed forces, then air force and navy too. So these three defense medical services provide opportunity for nurses too. So they can also work as an occupational nurse. Like it's mandatory for the occupational security for every industry. They have to place nurses inside the industry for occupational safety and to prevent occupational hazards. So again, that is opportunity for our nurses. So they can work over there too. And nowadays, new trend has started. Like a corporate world has also created many cadres for nurses. Like they are working with companies, those who develop content, and many publication houses are there. Those who are employing the nurses for this content, and there are medical coders, those who are working in these insurance companies. So they're providing like a pre-placement 15 days course for nurses, and then they work as medical coder in insurance companies. And they are also working as remote healthcare provider through BPOs, that is business processing outsourcing units are there. Through that, they are providing that services, and many more services are, many more opportunities for nurses in corporate world. So they are utilizing that, they are grabbing that. So many companies, those who are providing opportunity for nurses to be OT trainers, those who are moving abroad. So nowadays, I won't say like the opportunities are limited, and it's unfolding every day. Like every new opportunity is opening every day. So there are a lot of opportunities. It's era of nurses again, I would say.
Okay, you have used one word that is OET. Can you please elaborate that?
That is occupational English test. Basically, it's used for migration. Like if nurses are migrating from here to Australia, and some are migrating to England.
Like
So it's
IELTS.
like IELTS, like yeah. But IELTS is thoroughly for English, but OET is basically occupational English test where they used to assess the nurses' skill regarding like patient communication, how they will make the notes on files and all. So these all things they used to assess while they are providing or while they are giving visa. So that is
Okay.
one of the prerequisite of that.
Mm-hmm. All right. Okay, what are the recent advancement in nursing?
Wait. Are you worried about your project, training, dissertation, internship? Don't think too much because Nanoscience and Technology Consortium, in short NSTC, is giving you a golden opportunity to do the same tasks. NSTC also conducts workshop on amazing topics. So if you want to register in the workshop, the registration link is given in the description box below, or you may go to the website www.nanoschool.in where you can easily enroll in the workshops. So just check it out right now.
I would say like from the year I have started till today, nurses has advanced a lot. And nowadays, as we have heard, like we have received a revised syllabus last year. So our syllabus is now globally matched. Like they have matched the standard of our syllabus curriculum to the global standards to remove the hurdles. Like many of the nurses are, wishing to work abroad. Like they had hurdles like how do they work over there? How can they work over there? They had to, appear for this test, or sometimes they face difficulties. Their hours are not matched and all. So that has overcome with this revised syllabus, and this syllabus is quite focused toward the competency developments, and the assessments is also based upon the core competencies assessment skills, so that make them perfect fit for the every job around the world, right? So that was one advancement. And next is like evidence based practices. Now nurses are more keen toward research and all, so they are contributing a lot for developing new practices, new skills, and producing more evidences every day. So that authentic evidences further help us to develop our profession very perfectly in line. Like so, that is second. I would say development, and the third most important element. Now nurses are entering into entrepreneurship. So many of the universities they are providing seed money. They are motivating them to come with the idea, and many of the nurses they are entrepreneur too. Like they have developed apps, they have started companies like home care agencies, and many other nurses like those who are indulged into many kind of entrepreneurship. They are providing employment to other nurses too. So that is the advancement I have observed since the day I have joined nursing.
Okay, according to you, what is the most important thing while giving an interview? I mean, for a student, I'm talking about for a student, like when a student is giving interview. So, what type of interview tips you want to give?
I would say like one has to be very confident. That is a key to appear any interview first. And the confidence always comes with knowledge and skills you have. So you have to very thorough. You have to be thorough with your skills and knowledge of your profession. If someone asks you, must have answer of everything. Secondly, how one can explain his or herself, like he or she fits for that offered job, like how perfectly he fits. So that is the key. I would say like one has to learn before appearing an interview for nursing jobs, especially because it's totally skill based, profession, and they will assess the skills and your practical knowledge firstly. And research is also part of it. Nowadays research is quite focused, so one has to be thorough with the research work also. So if he or she has done any research work during his graduation or post graduation, so one has to be thorough, like if they have done it, so they have to be thorough with, and they have a deep knowledge of his or her project. So that is the key to crack any interview in nursing.
Okay, so you have used two terms, especially that is confidence and knowledge, right? If I talk about the interview tips, fine. Okay, last but not the least, a message which you want to give to the nursing fraternity.
I would give a message like every nurse has to strive for perfection. They have to participate in every research work so they can improve their knowledge and participate in our nation building, because our nation is again insisting upon providing quality papers that further will be a building stone for our profession as well as nation.
Well, thank you so much, Dr. Kohli, for this wonderful interaction. And you have covered really very, very nice points. Like we have covered what are the career opportunities. Then secondly, we have covered what are the recent advancements. And apart from that, you have given the interview tips as well. So thank you very much. Thanks a lot. Thank you.
Thanks for providing the opportunity. Thanks.
For more updates, subscribe to our channel, click the links shown on the screen to stay connected.